So इसका so it's diagnosed as Aries simplex. Okay, so then the next thing is the bug, and so इसका जो bug है that is hemolytic group A strep जो कि इसको cause करता है, तो इसका भी course augmentin है, and if augmentin doesn't work then we move to cephalosporins. Okay, so the next thing is this lesion. Okay, so this one kind of doesn't even look that bad, but actually in reality it is much worse because it's not well demarcated, so we'd say okay, it's not palpable, so it's just like a patch because it's clearly more than 1 centimeter, right? You can see all of this redness, but it's not well demarcated. But when it's not well demarcated and it's like sort of diffuse, that shows that the lesion is deep because it's spread like this, right? In these directions. But if I were to like kind of make like butch something, and this is going to be penetrating the subdermal and dermal layers, so this is actually cellulitis and it's much more dangerous, so we're just going to send this patient in for referral to derma. Okay, so both of these pictures show acne vulgaris. This was pretty like very obvious क्योंकि ये बहुत a common lesion है, but how would we describe it? So we know that these are pustules, so we can also see like macular papular rash, but it's also pustulous, and we see areas of like a little bit of raised lesion, so you could even call it like a plaque or patches, right? And then pustules, of course. And then this is mainly found on the cheek on this patient, and then on the forehead on this patient, and so acne vulgaris is the acne vulgaris is the diagnosis, and then the bug is QT bacterium, which I think should not have an E in it. It's QT bacterium. Yeah, जो कि gram positive है. So this is इसका जो treatment है, you just tell the patient to wash their face with plain water and only use a non comedogenic soap once daily. Do not pick at your lesions, because if you pick at them, it's gonna cause further acne, it's gonna cause scarring, and then we're also gonna tell them to not use comedogenic makeup, and we have to rule out depression and PCOS, especially in women. And then first line, we're gonna advise benzyl peroxide, which we give at night, and for the daytime we give clindamycin, which is 1%. And then if that doesn't work, the second line is doxycycline, 100 mg BAD, and then 4 to 8 weeks, of course, oral, and then maintenance dose is 100 mg OD. And the side effects is because of course we're giving an antibiotic, तो C diff हो सकता है and toxic megacolon है. The one thing जिसमें इसमें मैंने mention नहीं किया, जो कि probably is worth mentioning, इस केस में जो third line है, we obviously move towards isotretinoins, and we also can use like Accutane, which is like is the specific brand name. Okay, so then let's move forward to this lesion, which is basically, when we describe it, it might look like a malar rash, but the reason that malar rash is different is because it's nasolabial sparing है, and as you can see, the nose is also spared. Isme the nose isn't spared, and then the upper lip is also erythematosus. So how we would describe it is, of course, it's erythematosus, it's bilateral, it's on both the cheeks and the nose and the chin and the nasolabial folds, and this is not raised, and it's like red, so these are most likely patches, but we can see a bit of raised, like थोड़ा सा इसमें raised element भी है, so of course that would bring us to papules. And इसकी जो causes हैं, those are usually due to hot beverages या फिर spicy food, alcohol, which makes it worse, especially wine. So you would tell the patient not to have this, and this is acne rosacea. So then what this is a really dangerous case, because this is telangiectasia, which converts to rhinofibroma, and so we have to immediately, it converts to that, and we give referral to the derma section so that they can initiate laser process.